about why many students fail despite the fact that they know the subject. उन्हें आता तो सब कुछ है लेकिन फिर भी नंबर कम आते हैं या फेल होने की नौबत तक आ जाती है। तो ऐसा क्या है कि हम कुछ ऐसी चीज़ जानें जिसको स्टूडेंट्स ज़्यादातर नेगलेक्ट कर देते हैं। They don't pay attention at all. So many times these students pay attention on that I know this topic, thyroid is there, I know many things about the thyroid. So if the question is of 10 marks, they try to write everything about the thyroid that they know. If the question is of suppose 5 marks, at least they will fill one page. But the most important point is that they don't pay attention to the question. So reading question and understanding the question and then planning the answer and then you have to write the answer. आपने क्वेश्चन देखा, आपने फटाफट आंसर लिखने की जल्दी करी। आपने यह नहीं देखा कि what has been asked in the question, क्या पूछा गया है आपसे और आप क्या लिख रहे हैं। आपसे डेफिनेशन पूछी गई, आपने एक वर्ड निकाल दिया डेफिनेशन में से, डेफिनेशन पूरी की पूरी चेंज हो गई। फॉर एग्जांपल स्टेरिलाइजेशन एंड डिसइंफेक्शन। सो देयर इज़ ओनली वन डिफरेंस बिटवीन द स्टेरिलाइजेशन एंड द डिसइंफेक्शन इज़ द क्लियरिंग of spores from the surface. If along with the vegetative bacteria, virus, protozoa, fungus, we remove the spores, the process is known as sterilization. But if spores are not removed because of any reason, because our cleaning method was not adequate to remove the spores, so that means that is your disinfection. So just by not writing that the removal of all vegetative forms along with the spores is known as sterilization, but you have written removal of virus, fungi, bacteria, protozoa is known as sterilization. So definition is changed and you are not given any marks. So similarly, when something is asked about suppose fistula and your sinus, so you don't pay attention, and in fistula many students write a blind tract lined by epithelium or the granulation tissue. In case of fistula, connecting tract between the two hollow viscous lined by granulation tissue. So here granulation and epithelial lining just change the meaning. So similarly, when students are asked about the head injury and how by knowing the mode of injury can help in your diagnosis and treating the patient. So let's discuss few questions that are there. So you can see, define sterilization, draw labeled flow chart to show various methods of sterilization with their pros and cons. So first here you have to write the sterilization, definition of the sterilization. Then you have to draw the labeled flow chart. You don't have to write anything extra so that you can secure more marks. Process of removal of all vegetative forms of bacteria, protozoa, fungi and viruses along with the spores is known as sterilization. If spores are not removed from the surface, the process will known as disinfection. So this you can write or you don't write. So better not to write this portion, that is the disinfection. You are asked sterilization, just stick to the sterilization. Now draw the labeled flow chart to show the various methods of sterilization. First write in the center sterilization. Then there are three main methods of sterilization. First is by heat, second is by chemical, and third is by radiation. So there are three headings. Now in the heat you can add flaming, or you can do red hot by doing through the flame. Second is autoclave, third is your hot air oven. So better to divide the heat into dry heat and the wet heat. So in dry heat you will have hot air oven and the flaming. So in your wet heat it is the, you can say, autoclave. You can write boiling also, but you have to be very specific that boiling does not kill the spores. Similarly, in case of chemicals, you can write gases as well as liquids. In case of radiation, gamma radiation is the main radiation that is used to sterilize the mass equipments or large quantity of disposables, because these rays have very deep penetrating power. So now comes to the chemicals. In case of chemicals, you can write gases and liquids. In gases, your ETO and formaldehyde. In liquids, you have Sidex, that is glutaraldehyde, and formalin solution also. Similarly, in case of dry heat, hot air oven is there. Then autoclave is there, where the steam is main ingredient that destroy the virus and bacteria along with the spores at very high temperature and under very high pressure. So what are the advantages of using gases and what are the advantages of using wet heat, that is autoclave? So when we have written hot air oven, so you can simply say the pros and cons. Pros, these are quick method. We can sterilize many things like glassware, instruments. Cons, we cannot sterilize the heat sensitive equipments like many scopes, electronic equipments, plastics, gloves. Similarly, in case of flaming, to make the instrument red hot. So flaming is mainly used to sterilize the loop that we use in the microbiology to inoculate the culture medium. So when the loop becomes red hot, that means all the spores and bacteria and other viruses are killed. Similarly, in case of autoclave, autoclave is very effective and we can do large amount of equipments even wrapped in the 2 layer of sheets. So because steam is at high temperature and high pressure, so it has got a very deep penetrating power. So it can penetrate many layers of clothes in which the instruments are wrapped. So it can kill all the forms including the vegetative and the spores. But we cannot sterilize the sensitive equipments like plastics, scopes, joints may loosen up if the things are not made for your autoclaving. Similarly, electronic equipments. Here comes the roles of gases. So pros and cons of autoclave: very effective, deeply penetrating, and can be used for mass scale sterilization of the equipment. But cons: heat sensitive equipments, plastics and scopes which are not made for autoclaving, so we cannot use. Here comes the roles of ETO, that is very effective, deeply penetrating gas. So in this case we can simply say these are the cons and the pros, and the cons is that it is a costly and it is not viable if our equipment load is very less. but it is very effective in case of sharp instruments, in case of electronic equipments, endoscopes. Now comes the liquids. In liquids, the commonly used is the glutaraldehyde that is used to keep the scopes which are not, you can say, autoclavable, or the equipment that which are not autoclavable, like in the, you can see, the emergency rooms, some artery forceps, your other instruments like alleys, forceps, blades, threads, we can keep in the Sidex. So that Sidex has a life, or you can say shelf life. So whenever we activate the certain amount of Sidex, we have to label it, and according to the load which we are putting on that Sidex solution, so there is always an expiry period, 15 to 20 days. So whatever it may be, depending upon the instructions given on the bottle, so we can label it that this is the date of start and this is the end date. Beyond that, it should not be used. Even many times when it changes color because of the heavy load, so you should avoid using before the expiry date of that prepared solution. Now comes the radiation. We have already discussed the gamma radiation, deep penetrating power. So many books have written ultraviolet rays, though ultraviolet rays can only cause the disinfection. It is used to disinfect the OT rooms, wards, cabins, and patient rooms. So these take very long time, and these ultraviolet rays are not sufficient to kill the spores. Similarly, formaldehyde gas is used for the fumigation of the operation theatres and many places. But the cons of the formaldehyde, these are carcinogen. This is a carcinogenic gas and very irritating to the nasal and the eye mucosa. So in this way, just on a single page, you can write in a few lines pros and cons and your answer. So here now the second question is define NOMA. So how we can define the NOMA? NOMA is a, you can say, very dangerous disease and rapidly progressive, and it is necrotizing stomatitis or gangrenous stomatitis, because the bacteria that cause this NOMA, or you can say the cancrum oris, are able to produce proteolytic and lipolytic enzymes. So they destroy the fat planes and they destroy the fascia that contains the muscles, and they even can destroy the muscles and bones. So rapidly progressing, and in the early stage damage the various barriers of the body tissues. So ultimately after few months you will find that the part of the nose is lacking, there is a big hole in the cheek along with the destruction of the bone. So give reasons why the disease is dangerous and rapidly. I have given the answer. Why its treatment requires multidisciplinary approach. If you read the NOMA, it is more common in the children, and that too in the nutritionally deficient. So that nutritionally deficient children are emaciated, weak, with poor oral hygiene, lack of facilities of the early medical care, and lack of financial support. So all these factors play a role in not getting the early treatment. So Why multidisciplinary approach? Because we have to treat the psychological aspect of the patient because of the deformities. We have to treat the nutritional deficiency, we have to correct the medical problems, we have to correct the dental problems, we have to correct the deformities and the loss of bone. We may have to take the bone graft and take the help of the plastic surgeon. So here the role of psychiatrist, physician, pediatrician, dentist, facial-maxillary surgeon, plastic surgeon. So that's why it requires a multidisciplinary approach. Single surgeon cannot treat it, single physician cannot treat it. So just in a few lines you can write the answer. So now you must be knowing that you have to write the answer very carefully. If you write one page and the examiner has to spend 4 to 5 minutes on a single page. So if you have written 10 pages, that means 10 into 4, that is 40 minutes on your one copy answer sheet. So that should not be the, you can say, the criteria of writing. So whatever is asked you have to write very carefully. So what is the exact method of writing the answer? First you have to read carefully your question, number 1. Then see how many marks are allotted to that question. Number 3, you plan your answer. So when you have planned your answer, then divide your answer into various headings: definition, flow chart, and various headings in the flow chart, pros and cons of every heading. So you can change the color of the heading, you can give one line space between the two headings, and you can underline the heading with different color. If some important point is there that is crux of the answer, so that you have to underline, so that examiner just by reading your headings and your main points get to know that you know the answer. Instead of writing from top to bottom in a single para, there is no space, no full stop, no heading being displayed separately, there is no space between the two headings. So you have written in a continuity, and examiner has to dig into the answer to find out that you know something or not. So in that case, if examiner have to check suppose 100 copies, so you can really think that how much time is required to check the answer sheets of a one batch. So that should not be the case. In that case, examiner may or may not spend so much time, and who is the loser? You are the loser, because you think that you have written everything, still you didn't get the good marks. So be careful in writing your answer, read question carefully, plan your answer, and then start writing. Between the two answer, you have to give a proper space, or better to write one answer on the one sheet and the another answer on the other sheet. A few lines are left below the one answer, better to leave that and then start on the next page. So thank you very much, and be connected. So tomorrow we will discuss the question paper that has been asked in the setup of the dental third year students. Thank you very much.